Operation Smile has been in existence for 40 years. Our main objective is to really touch the lives of children with cleft lip and cleft palate. These children's lives can be changed just with surgery. We also are very dedicated to the comprehensive care. They need to adjust to what life can be really like without being bullied. It's tough for them. And so with this surgery, we look forward and we are so dedicated to these children.
More than 4,000 babies are born with a cleft lip or palate every year here in the Philippines. And a nonprofit organization has been taking steps to treat these children and give them the care that they need, one smile at a time. I'm Dr. Freddy Gomez. Join me as we learn more about Operation Smile, their advocacy, and the programs they're conducting to elevate the quality of cleft care here in the country. Welcome to Med Talk Health Talk. Founded in 1982 by husband and wife Bill and Kathy McGee, Operation Smile is a non-profit organization that specializes in expert cleft repair as well as care. To tell us more about this and something new that's happening with the organization, we have with us today Kathy McGee, who is the co-founder as well as president of Operation Smile. Hello and welcome, Kathy. Glad to be on the show.
We're glad to be here.
Let's talk about Operation Smile. Let's talk about some of the beginnings, because for over 40 years, Operation Smile has created thousands and thousands of smiles and happy faces for children with cleft lip and palate. Tell us how it all started. How did you and Bill think about having Operation Smile?
He's a pediatric plastic surgeon, so he only takes care of children, and I am a pediatric nurse. So the two of us were asked to go on this mission to the Philippines, and so we got over here into Naga. It was so poor, so rural, but the people were standing in front of us, 300 children and their families. The kids, 300 of them had cleft lip and cleft palates. We had never seen anything like that in our lives. But what drew us back was one little mom who came up to us with her little child holding her hand and said, I want to give you these basket of bananas because I want to thank you for trying to take care of my child. We never touched that child. Can you imagine that? We were so struck by the kindness. That's what drove us back. We came back the next year to try. We only did 40 that year with 300. We came back to try and finish those. No, in Naga, more came to the site because they knew they could be treated. Okay. These families have nothing.
You were able to see the love and care that Filipinos have, not just for their own countrymen, but for other people as well. So at that point, you saw 300 children, you're only able to do 40. It made you come back to do more. Why do you think cleft lip and palate is something that's significant, is something that should be addressed, especially here in the Philippines?
Well, I think cleft lip and cleft palate, think about it, you're not speaking, you're not eating, you get very malnourished from not eating, and you have a facial deformity. Right. That means every day people are making fun of you. It's very difficult for these children, and it can be fixed. You know, it's not something that if you address it, and we had the skills, we were like, okay, we can fix this. We can get more friends. We can add to this. These are all medical volunteers. No one gets paid. Okay. And so we said, all right, we'll build our team for next year and come back and finish, we thought.
That's good to hear, and I'm sure our viewers are really interested on what cleft lip and palate is and what they can do about it, but we'll cover that a little bit later. But now I'd like to know about Operation Smile. It's been around for 40 years. How has the operation expanded since that time in 1982 and up to now?
In 1982, we thought we'd come back and finish those kids in Naga. But then it spread, and Manila heard, oh, this team is coming. Maybe they could do Manila, maybe they could do Pampanga, maybe. So we kept asking more friends. And so it spread. We are now in 40 countries operating all over the world, in Central South America, the Middle East, and Asia. We're everywhere. These are very dedicated volunteers.
Right.
Yeah. committed, and they're excellent at what they do. Maybe these children have a one-time chance. We want it right.
And that's very good to hear because over the years, Operation Smile has remained constant. Let's talk about the future a little bit because coming into the 5th decade of Operation Smile, there is a new program now that has a bigger impact. It's called the Women in Medicine program. Tell us more about this, Kathy.
We decided, let's give it a try. You know, the women take care of their families every day. They're multitasking. Let's put just women together. And the most important thing here is we are lacking so many medical people. 5 billion people go without health care. How do we get to these people? So we expanded across the world with mostly all medical volunteers. And now we have clinics where the children can come back for dental care. We take care of their teeth. We make sure they can speak, so speech therapists, psychosocial, get back to school, give confidence back to these children so they can face every day.
So definitely a lot of positives that can happen with children who are managed through Operation Smile. But let's focus on this Women in Medicine program because currently, there has been some research that majority of healthcare professionals in the world, not just here in the Philippines, are comprised of women. What kind of significance does this program have with what is currently going on?
What we've decided with the Women in Medicine, because we know that 75% are women, and 25% of them only have leadership positions. So if maybe we could do some more mentoring, provide more skills, and have them be leaders in the field, this could drive the medical out of just the cities and take care of those kids on the outskirts.
Now, Kathy, as a woman in the healthcare field, how important is this program for you?
You know, I've always, as a kid, wanted to go into the developing world to help people. And I said, the only thing that keeps me up at night is we need to get to the rest of those children with the cleft lip and cleft palate.
Now, Kathy, you are truly an example of a woman who is empowering other people, especially women. What advice can you give? How can you continue empowering women, especially with this new program?
Well, we do have programs now where we mentor. We want to see what are those barriers that are stopping, these women on these outskirts from coming in. Maybe it's funding. So what is it that we can do to drive this so we can have more women to enter this field? It's very powerful if they can take, the leadership for the future.
Definitely a great program, especially empowering women to move forward. And it is also addressing the current problem now of a lot of healthcare professionals, healthcare workers who are leaving the Philippines for better opportunities. And this program definitely helps in that regard. But we'll talk more about that later on. After the break, we all know that repairing cleft lip and palate will do a lot of help for children, not just here in the Philippines, but around the world. Now, when MedTalk Health Talk returns, we'll talk more about the specifics of cleft lips and palates. Welcome back to MedTalk Health Talk. Now, a cleft lip or a cleft palate is one of the more common disorders here in the Philippines today. Now, to talk more about this, we are still joined by Kathy McGee, who is the president and co-founder for Operation Smile. Now, Kathy, for any parent to discover that their child has a physical deformity, cleft lip or cleft palate, it can be very concerning for them. How should they approach this for those parents, for the parents who might be watching now and they see that their child has a cleft lip or palate? Is this something that can be easily repaired? What's the timing for the repair?
Cleft lip and palate, let me tell you, it not only affects that child, it affects the family, the community, and the country. This is a person who will never work, never go to school, never really be nourished. So we really encourage these families to take care of these children, and it can be done. We like to see these children by 6 months, no later, for the lip, and then the palate is done at 18 months. We like them a little older here because they're out in rural communities, and we want to make sure they're healthy. We're very very careful touching these children, and the quality is most important to us.
What about the older kids, Kathy? Those who are already probably in their teens but have never had their cleft lip or palate repaired in any way. Is there still a place for them in Operation Smile?
Honestly, I feel for these older kids because they just want to have a life and they really don't. We looked at this and said, I will explain it. It's an obturator, but it's just an appliance and it's in the roof of the mouth. We make them when they come in, make sure it fits, and they wear that and they can speak and they can eat, and then we wait for that surgery to happen. So now with these clinics, they're hospital partners in Pampanga, Davao, Cebu, we can really address these older kids now.
Now, I'm sure a lot of people who are not aware with cleft lips and palates are probably wondering, where does this come from? How does this happen? What causes cleft lips and cleft palates?
Well, Operation Smile is doing research now. We do it with the University of Southern California in Los Angeles, and we've taken many samples here. So they're swabs, and we look at the genetics now, and also we have questionnaires for the environment. Most of these families were eating 8 cups of rice a day, no protein at all. So we start talking about nutrition. Nutrition is a big thing, but we also know there are environmental issues. We ask these questions to them. 50% of women cook over open fires, so the smoke they're inhaling it, and 50% of them had children with clefts.
It's good that Operation Smile is on top of research as well. Now, according to Operation Smile statistics, there are around 5 million patients in need of cleft care here in the Philippines. 5 billion people who lack access to safe surgeries around the world. That's a big figure. How does Operation Smile help all of these needy children? In over 40 years, Operation Smile has been helping. How is the current outlook now when it comes to these figures?
What we're doing in order to try and address this big need is to go out to district hospitals. These district hospitals are rural, there's not good equipment, the people aren't trained that well, and so we're connecting our universities. Those universities are going to train. We're calling them champions. These champions will spend 2 to 3 years coming in and out in those district hospitals to really upgrade the way people take care of surgically or even medically. So that's a system then that gets put into place, and it's sustainable. Once we put good equipment, we're going to pay for the equipment going into these district hospitals. We feel like we can really address what WHO is saying. Could you help us take care of these 5 billion people? What do you do to really encourage medicine for the future?
That's great to hear, Kathy. Now, people with cleft lips and palates are often discriminated on, and that is also something true here in the Philippines. How can the quality of life of someone with a cleft lip or palate be improved through Operation Smile?
Operation Smile has these clinics now, so we do the surgery, but you must have speech training. So we have speech therapists that are volunteers also, and the dental work is very important. It's the comprehensive care that really actually will help make that change. And I encourage these families, treat these children normally, and so they have confidence. Honestly, we don't know the lives we touch, but we see a lot of them come forward.
That's great to hear. Where does Operation Smile try to be in the next 5, maybe 10 years, Kathy?
The ultimate goal is we said we'll take care of 1 million people over the next 10 years. So that's really driving those centers, that's driving the education so we can be sustainable. We will do lots more surgery. We have a big center now going into Cebu, and we're going to really try to touch those 77,000 children in the Visayas. So we're driving this medicine for the future. Not only just the cleft lip and cleft palate, but also the systems would be in place with good anesthesia, good intensivists.
Now, do you have any message for our viewers out here, especially those parents who might have discovered their child may have a cleft lip or palate, or someone who knows someone with that condition?
Operation Smile loves to encourage, everybody here, come forward. We are doing free. Not one patient is ever charged for anything. We take care of those children. We will never ask for any money, and we will do the post-operative care. All the comprehensive speech and dental work, all is free. So we encourage those families to get to the website, just call the Operation Smile Philippines in Manila, and we will take care of that child.
That is definitely something that a lot of people will be happy about, and how Operation Smile is thriving through so many years, and we're looking forward through many more years to come of Operation Smile helping Filipinos who need their service. So thank you very much, Kathy McGee, for joining us and explaining to us all this information when it comes to cleft lips and palate.
Thank you so much for having us.
Women play a crucial role in taking care of kids with cleft lips and palates. More on that when Med Talk Health Talk returns. Many Filipino children are living with a cleft lip and or palate. Now, in order to help treat them, we first need to support and strengthen our healthcare system. Let's take a look at how Operation Smile does just that.
I am Dr. Vivina Chu, a pediatrician and an international volunteer of Operation Smile International. As well as I am the Vice President of the Mariquita Salimbangon Yong Charitable Foundation, who is a partner of Operation Smile, this surgical program. Women are the best role model for leadership, especially in medicine, as well as in any advocacy regarding medicine. Now, if you look at the statistics, especially now in medical schools, there are more women enrolled in medical education than men, but only very few becomes leader. Now, if we will set an example and lead them the way to become a good leader, we will be able to partly solve the problem. I would like to compliment the Operation Smile International in launching this Women in Medicine, because it's about time that we women should lead our colleagues to spend more time in their advocacies, as well as making sure that healthcare delivery is given to the underprivileged. Every year, there's improvement in the program of Operation Smile International, and this time they are including the subject on nutrition. So for our forum, this is an international participation of volunteers. So we made them aware that not only surgery for the cleft lip and palate should be addressed, but as well as the nutrition, which is a very important factor in care of these patients. When we do all this surgical program, all these patients who underwent surgery has to be followed up. We do not just leave them alone. And this can only be done by women who has compassion and care for the patient, and make sure that the outcome of our advocacy is in place.
Surgical repair of a cleft lip and or palate is vital in order to elevate the quality of life of a child. Now, in order to grasp how essential it is, let's speak to parents of children who have this condition.
Ako nga po pala si Cherry Ann F. Ababa. Nalaman ko po nung nagpa-ultrasound po ako, 4 months around po yung baby ko po sa tiyan. At sobra po akong natakot kasi wala po akong alam kung anong gagawin. Nahirapan po akong padidehin si baby ko kasi po unilateral cleft lip po siya at saka full palate. Kapag lumalabas po kami, marami pong tumitingin kay baby noon kasi yung kanyang lips po ay hindi pa po nakatahi.
At first, hindi ko talaga alam na cleft siya. During lang nung nag-labor ako sa kanya, so na-shock na lang talaga ako paglabas niya. Siyempre, as a mother, hindi ko talaga ini-expect na ganun. Masakit para sa akin, pero since nandiyan na, and I know na bigay siya sa akin ni God, so tatagapin ko. Nung una, siyempre mahirap talaga, especially yung pag-feed sa kanya. Siyempre, uncomfortable siya palagi sa kanyang situation. Tapos, dapat maingat ka. As in total adjustment talaga, and a big challenge for me.
nakita ko po yung Operation Smile. May free operation po sila para sa mga may cleft lip at palate. Na-assess na po nila at nakita po nila na okay naman at healthy si baby, ay i-schedule po nila sa operation. Sobrang saya po namin kasi sa murang edad po ni baby, mga 6 months, ay naoperahan po siya sa kanyang lip.
Masaya talaga ako na nabigyan ng chance sa Operation Smile. Yung 6 months siya, naoperahan siya, and it's a great feeling. During that time, nag-took ako ng video sa kanya, tapos nakatingin siya sa video. Feeling ko na-amaze siya na nakatingin siya sa mukha niya na naka-fix na yung lip niya.
While children with cleft lip and palates are sometimes misunderstood, it's never too late to be an instrument of hope and smiles. I'm Dr. Freddy Gomez. Thank you for joining us here on MedTalk Health Talk.